Thank you very much, Senator Malalah.
Thank you, Madam Speaker. Madam Speaker, I rise pursuant to Standing Order number 47-1 to make a statement concerning the looming health crisis in Kakamega County, exacerbated by the COVID-19 pandemic in the country and a serious dereliction of duty by the Kakamega County Government Executive. Madam Speaker, I wish from the onset to remind this Honorable House that in July 2019, I carried out an intensive fact-finding circuit of all public health facilities within Kakamega County and shared here the despicable state of the public hospitals in the county. The Senate Committee on Health took up the matter under your direction, Madam Speaker, and paid a visit to Kakamega County Executive to delve further into those matters. The committee came up with a summary of what was bedeviling the health sector in the county and gave recommendations to the county government of Kakamega to help in revamping the health sector of our county in order to save the lives of the great people of Kakamega. Madam Speaker, it is sad today, I'm still sharing here again that the health sector in my county is still deteriorating amidst the COVID-19 pandemic. The situation is now deplorable, despicable, and dehumanizing, to speak the least. Healthcare issues must be at the center stage of any government, and hence a government that does not see the need to prioritize healthcare matters, especially at the moment of COVID-19, has no interest of the citizen at heart. Madam Speaker, the county is fairly well endowed with natural resources, including gold. My people are among the most hardworking Kenyans, contributing substantially to the growth of the economy of this country. The county has an oversurging population, now close to 2 million people, and is at the epicenter of Western region development. Madam Speaker, I must bring to the attention of this House that during this COVID-19 pandemic period, the County Assembly of Kakamega appropriated 105 million shillings, 50 million shillings as emergency fund, while the national government gave out 262 million shillings to Kakamega County Executive, hence totaling to around 410 million shillings, ostensibly to help curb the spread of COVID-19 in Kakamega County. Madam Speaker, up to now, there is nothing substantive to write home about on how these funds were utilized. My county, with such a huge population, Madam Speaker, has only 5 isolation centers with hardly functional facilities. The county boasts of having a gene expert machine, a machine which tests COVID-19. However, the machine is dysfunctional, lying idle at the Kakamega County General Hospital, and hence my county has to send medical staff with samples to other counties to test for COVID-19. Madam Speaker, even after receiving the above stated funds, the Kakamega County residents have helplessly witnessed closure of many public dispensaries. Madam Speaker, they have never received masks from the county executive, Madam Speaker. This deteriorating state of healthcare in my county during this COVID-19 pandemic, and even after the county having received the funds, only leads to a conclusion that the funds have been embezzled. Madam Speaker, I want to call upon the Ethics and Anti-Corruption Commission together with other investigatory agencies, to move with lightning speed and investigate on how these funds were utilized. Madam Speaker, such dereliction of duty in the health sector could be one of the reasons why in the recent past my county has witnessed an upsurge in COVID-19 cases, a total of over 400 virus cases, out of which over 60 are health workers, largely on home-based care. Suffice to add that the healthcare workers also work under deplorable conditions and without PPEs. The rise in cases has led to closure of the county executive offices, hence halting the operations of the Kakamega County government. Madam Speaker, in the past weeks, the county has lost many residents due to COVID-19 related complications. Mr. Speaker, now, among the persons we have lost, one, Honorable Robert Sumbi, who is the Chief of Staff of Kakamega County. Honorable Sikunyi, who is a former councillor. Honorable Steve Ambulwa, who is a former MCA. Honorable Mebo Muruli, who is a former gubernatorial aspirant and a strong woman leader in Kakamega County. Dr. Alushula, a senior orthopedic surgeon in Kakamega County. And lastly, my good friend, Mr. Ken Aliona, the wholesaler trader in Kakamega County. All these and many more others, Mr. Speaker, have succumbed to COVID-19 related complications, and if the situation is not averted, more lives are going to be lost, Mr. Speaker. We cannot wait to lose more lives, Mr. Speaker. Action must be taken now. We must therefore intensify adherence to the COVID-19 protocol restrictions, enforce the social distance rules, revive the hand-washing points, and ensure all learners in schools wear masks and ban school visits completely. Mr. Speaker, in conclusion, we all know that health is a devolved function and a very integral area to our citizens' well-being. However, from the prevailing circumstances in Kakamega County, it has become obvious that the county executive has completely and absolutely failed to perform the function as required and as enshrined in Schedule 4 of our Constitution. As the representative of Kakamega residents in the Senate, I call upon the national government to invoke the provisions of Article 187 of the Constitution of Kenya and take over the management of health functions at Kakamega County to save the lives of the residents of my county. I rest my case. Thank you, Mr. Speaker.